Tonsil problems, primarily tonsillitis, is an extraordinarily common disorder. It's more common in children, but it's certainly common in the adult as well. And most of the time it's pretty self-limited and minor thing with which to deal, and generally it doesn't require much care. But there are, of course, the situations that are more urgent and more emergent, and there are also the situations of the patients who have recurring difficulties or long-standing difficulties who end up needing surgical treatment. Well, first and foremost, they can cause sore throats. Second, if they're really big, they can cause problems with snoring and sleep apnea. And occasionally, you can see issues where they can get a peritonsillar abscess. They can get an abscess in the lateral aspect of their throat. Well, treatment primarily for the person who has acute issues is primarily supportive. In general, just pain medication as necessary, hydration, and just, again, hand-holding may be the best way to describe it. It's really for the patient who has the recurring difficulties and the chronic difficulties for which tonsillectomy is appropriate. There's a misconception that tonsillectomy is in some way different for an adult than it is for a child, and that it poses actually any increased risk. And it really is the same operation. I think the difference is that children don't ruminate about pain and the discomfort, and they move on. For the adults, we really have a pretty miserable experience with it. But the risks are the same. The procedure is basically the same. But the recovery certainly seems to be different.